Hi, I'm Dr. Prathyush, consultant orthopedic surgeon in Pace Hospitals, High Tech City. A total knee replacement is nothing but removing your parts where there is osteochondral or osteoarthritic changes that are mostly prevalent in femoral and tibial components and placing them with a new components that will help to ease the pain and free mobility of your knee joint. Total knee replacements are generally two different types. One is unicompartmental and bicompartmental. Mostly we generally prefer bicompartmental instead of unicompartmental because of the success rate that is there and less amount of pain that will be present in the patients post-operatively also. Coming to the total knee replacement procedure, so this is your femoral component and this is your tibial component. So after doing all the cuts, what we will do is we will place a new femoral component over here and the tibial component will come over into the tibia and the joint is reduced. So like this. Depending on your patellar compartment, patellar osteoarthritis and everything else, the patellar replacement will also be done at the same time, but only if it is indicated then we perform the patellar. Otherwise the normal patella, if it is fine, that is placed. So after total knee replacement, this is how your joint will look. So it will have a free range of movements completely in all directions and stable joint. That's how it is. The main indications for total knee replacement is severe osteoarthritis in the patients with more than grade 4 with severe osteophytes, and also if there is any plateau, tibial inclination, declination, then we perform the total knee replacement. If there is any severe infection in your body that includes urosepsis or blood infections or throat infections, generally we wait until the infection subsides and then we perform the surgery. Coming to the benefits of the total knee replacement, generally the total knee replacement gives you the luxury of your knee joint back into your life with less pain and freedom of walking, running and jumping also, and also sometimes you can climb your stairs also. The complications mainly every surgery has its own complications, like minimal amount of infection like that, but I have encountered zero complications in the total knee replacement till now. So if the patient follows the regular orders which we give of physiotherapy and take care of the knee replacement which was being done properly, then there won't be any complications for the patient. Yeah, coming to the safety and efficacy of the total knee replacement. Total knee replacement is the safest procedure which we can nowadays, which we are practicing daily. That is the best choice the patient can have in the severe osteoarthritis in the patient, because the patient will be having a lot of pain, which is only relieved with this total knee replacement. Lasting of the knee replacement, it depends on the amount of the implant or the type of the implant which you are taking. Generally a regular implantation will give you around almost 50 to 20 years of life, and something like an oxonium will give you around 20 to 25 years of life, and something around cobalt chromium, gold cobalt chromium and albunium combination is going to give you around 30 years of life, is what the study says. At the total knee replacement, generally the success rate depends on both factors. One is the patient factor, second is the doctor's factor. Even though the doctor has been performed the surgery well, it all depends on the patient factor, right? The patient has to follow and do the regular exercises and all the physiotherapy, regardless of the pain that patient is going to have for the few more days, like up to 5 to 7 days post-operatively. But if the more the patient do exercises, the output will be that good. The patient will be mobilized to walk from the 4th hour of the post-surgery. Immediately after breaking of the NBM, patient will have some food and we'll make sure the patient is walking after the 4th hour, whether it is of bilateral or unilateral TKR. That is how we are managing nowadays. Yeah, coming to bilateral total knee replacement, it all depends on the patient factor. If the patient heart and the general condition of the patient is fine, then we can go with a total knee replacement simultaneously. If there is any contraindication for bilateral total knee replacement, like his EF and everything are a little bit lower side, and the patient is very elderly, then we can do staged procedures of the bilateral TKR. Generally, the patient will be immobilized immediately after the surgery. So, for all the suture removal and everything else, we generally take 15 days of time for the complete suture removal and everything else. Patient will be able to go to office within 3 weeks of the post surgery. Coming to the do's and not do's, the do's are like you can walk how much ever you want, you can climb stairs, climb down stairs how much ever you want, and the not do's are don't squat and sit, no crisscross sitting in the floor, no sitting on the lower side of the stools, that's it. But rest of all works patient can do happily without any problem.